Hi, and welcome back to Partnership Live, our monthly discussion with New Jersey leaders who are changing the paradigm in maternal health. Joining me today is Victoria Lauture Duncker. Her podcast, New Mommy at 40s, is changing what's happening in the community, talking about infertility and giving us support. Hi, Victoria. How are you?
I'm so well. I'm so happy to be here. Thank you for
I'm
having
so happy that you're finally here talking to us today about what you're doing in the community.
me.
So let's start about what you're doing. Who are you? How did you meet? Just everything about you.
Thank you. Perfect. Again, I'm Victoria Latour Duncker, and my podcast, New Mommy at 40, was launched really out of a necessity, really. I wanted to, I knew that I wanted to be a mother. I didn't really see where this partner was going to magically appear in my 30s. I tried. I was in two long relationships that just didn't really manifest themselves to what I wanted, what I wanted in terms of a partnership to bring a
Mhm.
child into this world. And when I finally did and met my husband at 40, um, I remember having our child at 41, so it's a little off what, new mommy at 41 didn't sound quite as good.
No, not as catchy.
40, right? It's catchy, right? But technically, I was pregnant at 40, but I had her at 41, and I lost my mother probably about uh my child was like 15 months, and my mom passed away, and I was at her funeral, and someone came up to me and said, trying to comfort me, said, it's such a blessing that your mom got to meet your child before you passed away, because for years we wondered what was wrong with you.
Oh,
And I
thank you so
thought,
much.
yeah, I was like, what does that mean? I don't,
Mhm.
and instantly like two things came in my head. Do I correct her? Because there was this kind of like this it didn't feel good, obviously,
Mhm.
but I knew where she was coming from. So
Yeah.
I decided to find a middle ground and honor my truth, because what she didn't know is I had just miscarried twins as well,
Mhm.
literally 15 days before my mom passed away. So I wanted to honor my grief and also educate her. So I said, yeah, I guess it was a blessing, because with all the miscarriages and PCOS, and who knew? Like, I'm glad she did meet my daughter. That gave her perspective of this wasn't just kind of this, you know, this
Yeah.
thing, there was something wrong with me. There are things
Right.
happening that she wasn't even aware of. So it made me
Yeah.
want to create a space, because I felt we all probably had really different stories of how we arrived to parenthood at this time in our lives. And I wanted to honor the women who were like, yeah, I was having an amazing time and I didn't
And
want,
everything was so easy. Yeah. Yeah.
yeah. Or, and there's some of us who, like this, have three, four kids in our 40s, and some struggle. So I just wanted to create a space where we could talk about it and normalize the discussion about having children after, this advanced maternal age. And it's been something that's been beneficial to me, and it's been great to hear how it's impacted the lives of others as well.
It is just definitely so needed. You know, the partnership live we had prior to this, one of our guests was Dr. Serena Chen, who is a nationally renowned fertility specialist. And we talked about the statistics, which are abhorrent for women in general. But then when you start disaggregating the data specifically for Black and Brown women, it is really so challenging because we start later and then it is just more convoluted. We have more PCOS and fibroids and so many issues. And then people start going, so what's wrong with you? What's happening? What's taking so long? And they think that they're being nice about it, but don't know how to have the conversation.
Mhm.
So I know a little bit about you from the side. So prior to you going on this journey, I know that you did some acting. Do you want to talk about that? Did that help you in starting your podcast and getting that community support and starting that conversation?
Yeah, I think it did. I mean, yeah, I went to a conservatory for the arts, for theater and musical theater specifically, and I was in the professional I'm in one of the two of the professional unions for acting, SAG-AFTRA and Actors Equity. and had like a 20-year career of being in and out of the industry. The real working actors know what I mean. Like, there's a percentage of us who, our names, and others, we've been working along the way, in more, regional, off-Broadway, like working actors. But you may not know our name. I preferred that life because I didn't want to lose my freedom as long as I was able to create, and with my art and with my gifts, I was very satisfied with that.
Mhm.
And then, so I think, um, as many in this industry, there are times where you do have to kind of step a bit back and find some other way to supplement your income. And for me, that was in aviation. So with, again, customer service, and I did everything but fly the plane for like a 16-year career at JetBlue Airways, and then found myself in management. So when I had my child, I actually was on a leave from my day job, right, in aviation, and I just couldn't see myself going back. So when this came about to kind of tell my story, I found it really interesting how it was a marriage of my acting, of my customer service, of my need to kind of impact humanity in some way. That was actually one of the taglines of JetBlue back then, was bringing humanity
Mhm.
back to the skies. So it was kind of interesting how all of my travels and meeting people and observing even like parents on the plane before I was a parent, um,
Mhm.
and seeing what that process was like gave me a little insight of what I did not want to do when I had kids when it came to
Mhm.
flying.
Mhm.
So yeah, it's interesting how all of your, these little patches, I always have, my tagline and when I speak is like, we have this life quilt, and with made of all of these patches, and some, may not be the prettiest, may not be the best representation of maybe what we want our whole life patch or fabric to be, but all together make some really interesting quilts of life.
Yes.
It brought me here.
It is a menagerie,
Yeah.
absolutely. So going back to specifically facing infertility, I do recall not too long ago meeting with Senator Booker, who was speaking with women who were going through their infertility journey and how much it costs. And sometimes people are putting their life savings. It's not only the mental and physical toll, it's a financial toll also. So, in your journey with your podcast, what are the challenges that women are facing?
Great question. It is, people forget about the financial aspect. And what was interesting is, though I had my child naturally, we experienced four miscarriages after her before we tried 2 rounds of IVF. So I had already met some women who were telling their stories of IVF prior to me going into it. And I will say, even with that knowledge, IVF was still challenging even for me. So
Mhm.
what collectively, I think what our stories have been when it comes to reproductive or assisted reproductive health, um, is the financial cost does add stress to a very already stressful situation,
Mhm.
because it is one of the biggest gambles. You're not guaranteed a child after this process, but it's hope, because it's for those of us who had difficulty conceiving on our own. This is the next step of creating the families that we've had on our hearts and our minds for a long time. So when you enter when you go into a reproductive facility, I think one of the stresses is, does this team really understand my vision?
Mhm.
Do they understand what has brought me to their doorstep? And will they, I think, another challenge has been what protocol is right for this particular patient, because you don't want to be overstimulated. And if who are not familiar with the IVF process, there's a stimulation process that occurs to basically um, give you the best odds of having the most healthy and more number of eggs to
Retrievals,
sperm,
right.
retrievals. And there's a protocol, and no protocol is the same. And that's the other thing that, I think a lot of people don't realize is that it's good to have the conversations amongst those, in the community have gone through this before, but taking that
Mm-hmm.
moment to recognize that your protocol may not be like someone else's. Um,
Mm-hmm.
and also interviewing your team, I think is another one. It's great if the doctor has really great bedside manner that you're going to be dealing with, but a lot of times you're not dealing with the doctor until it's time for the retrieval. It's the staff as well. Make sure that the
Mm-hmm.
staff is responding, to your emails and to your messages. I literally lost a round with one provider, which is devastating, especially when you're closer to, I would think I was on the brink of my 45th birthday, and there was a change in my insurance policy
Mm-hmm.
for once you're 45, because some companies do not cover IVF retrievals with your own eggs after at
Really?
45. Yeah, there's some, not in the state of New Jersey, I don't believe. At the time, I don't think we were here. We were in New York. Um, but yeah,
After 45, really?
yeah,
Okay.
there's some insurance policies are not as optimistic about
Mm-hmm.
45-year-old eggs. And so you have to,
Mm-hmm.
I've had a friend or one of my guests hopped around search for different insurances because she wasn't going to let the insurance aspect, deter her from achieving her family. So,
Mm-hmm.
I think those are some of the challenges is just really doing your homework, understanding that you don't have to go with the first reproductive facility that you find.
Mm-hmm.
Really look at the reviews. I find that the CDC actually, is it org? The CDC website used to have really great information. I don't know
So
if it's up to date now within our current.
probably not. Probably
But
not, but this is why,
right.
your podcast is just so important, right?
Yeah,
Getting
even more
the people
now.
together for that information.
Yeah, because the CDC, I don't think they've taken it down, so don't quote me here, but you should be able to find the statistics for a lot of the reproductive health facilities in your area to find out breaking down, like what is their success rate for this age and all these other
Hmm.
factors. And
Hmm.
that's also very helpful.
Hmm. I know one of the things for this administration, we're not going to get into politics, is um, one of the things that they're going to be working on is decreasing the cost of the fertility treatments. If it happens, that would be great. But this used to be such a siloed conversation, and I'm sure in pockets of the world it still is because there's still a lot of shame. I know one of my friends is actually going through it right now, and she still feels, somewhat ashamed and fearful. And I was like, oh, there's a great podcast, New Mommy at 40. You should listen to it. So I know that you're bringing women together, making them feel empowered and making them feel definitely less alone. Was there anything that you've come across in your speaking to different women that really surprised you?
Yes, two things. I was surprised at when you say stigma, specifically in the Black community, and well, two communities within the diaspora, right? You have the Caribbean, African diaspora within the Black community and African Americans. Both share something that I didn't realize was there's this stigma of well, why can't you just have a baby? As if we
Mm,
just have this fertility magic.
yeah.
So that's why it makes it hard for a lot of women
Mhm,
of
mhm,
color to go this route and to speak about it because they just think it's for white or non-black people. Like, well,
mhm,
yeah, because I feel like in the space, more white women of Asian background do speak about it a little bit more. Specifically,
mhm.
I think more Caucasian women speak about it more often. So there's this that's why we need more representation within the
Right.
color within the community of for of people of color to talk about it because there's this stigma of like, well, just eat a couple of yams and
It's true.
or
Yeah.
or
Hmm.
the religious aspect also comes in of, well, just pray about it. You're not devoting yourself enough. And not to get into different faiths, of course, faith, if you're of the faith-based community, there is hope. There is something in that
Mm-hmm.
that I think is
Mm-hmm.
important, and not to poo-poo it, but it's not as simple. It's
Mm-hmm.
not as simple. Or the other fact, the shame comes in. You are pushing something along that maybe God doesn't want for you.
Right.
That's the other part that I've seen of like, well, why
Mm-hmm.
are you insisting on doing all of this stuff to your body? Why don't you accept that this is not part of his plan for you?
Mm-hmm.
And I feel like that's where I feel people should not really meddle
Yeah. Or
into.
that we waited too long because now you're going to get your BS and your master's and you're starting a business and see why did you wait so long?
Which is
Yeah.
different, which is interesting in that community because you have one aspect of like, go get your education. We need to be better than everybody, and we have so much to
Mm-hmm.
prove. Look, we came to this country for you to be educated and to establish yourself, and not no boys, no girls. Focus, focus,
And
focus.
now where are the kids?
Now it's
Yeah.
like, okay, I focus. I got my degree. I got my master's. I'm a doctor. I'm a nurse. I did everything that you said this to do. On top of that, you weren't so great about me dating in the first place.
Yeah.
Right? And now it's like, okay, but now my eggs, and especially for in talking about our women here, it's like, okay, now I'm in like this is it. And now I have this pressure of finding this partner that not only that I am crazy about, but also the others, the stigma of like, well, are they good enough for the family? How's the family going? There's all these other these aspects that just pressure that doesn't need to be there. It's hard enough. Um,
Yeah.
so I feel that was been really surprising of hearing the similarities between two communities that I feel sometimes feel like very different from each other. It's like
Mm-hmm.
there's one aspect in terms of our parent, the lineage pressure that
Mm-hmm.
is something that you find in both of those cultures, which was very interesting, but makes it another level of difficulty for those of us who are in the space and find ourselves. You don't wake up and know that you're dealing with infertility.
Right.
You don't know until you start trying.
So
And
have you, I'm sorry, have
no, no,
you
no.
found any from the podcast? Have you had your family listen and call you up and say, "Oh, Victoria, I didn't know this," or "I'm sorry about that. And because of this particular episode, I've now changed the way I speak to people, or I don't ask people this particular question, or I'm more sensitive." Has anyone in your circle or in your family, changed their ideas?
They have. I found that a couple of things happened because I was open about my struggles.
Hmm.
I started getting less of that. Well, okay, where's the other kid happening? When are you guys working on it? Look at you guys. Come on, you should be working on it. By me saying we did, and I lost that one. Oh no,
Yeah.
I lost the other one. Do you understand that I've had 7 miscarriages? Then it was kind of like it got quieter. And if the prayers are still coming, they were silent ones and not
Yeah.
like telling me what to do. And I've seen them, interestingly, in one family or one household who has 2 daughters in their 30s. I've seen more so of like, I need to let them have their lives and probably find their, like, you probably should move out. Like there's this like,
Mhm.
this kind of like staying, in the house and take care of me. It's like, well, if you're gonna have a future and you want this, I should let go a little bit more.
Yeah.
I've seen that happen, give them a little bit more agency. And I'm really proud of that because I
Yeah.
can see that change within my own family. But I
Mhm.
think what's been the most rewarding is hearing other people, I get the loveliest messages and inbox messages of how coming across the podcast has helped them talk about the losses. And I'm so thankful. I'm getting a little emotional. I'm thankful I did that because I did have a moment where I wasn't quite sure if I was going to talk about all of them because I really didn't understand. I wasn't sure if I wanted to focus only on hope and and kind of discard the painful parts. I know
Because
that's
then it becomes unrealistic, right? Because it's just so intimate. You're
yeah,
letting people into your relationship. But if
yeah,
you're only saying the good parts, people can't relate, right? It's like, oh, this is so Pollyannish. Like, this is
exactly.
not what I'm going through. I'm hurting. and nobody's listening to me. And, she's going through it, but everything's so rosy with her.
Rosie. And
Yeah.
it's interesting you say that because there is another person in the space, not a podcaster, but in the space of advanced maternal health and advocating for not just women of color, but just anyone having children over 40. And they had a blessing in their lives late in their 40s of having a child. And their platform is all about instead of saying why not, just why, or it can't, just say why not? Of course I can do it too. I had this child in this time of my life, and you can do it too, but
And sometimes you can't.
never addresses the other side. It's
Yeah.
there's no taking away from your blessing. I'm so thankful that she had that blessing, but that is just not the reality. The science doesn't support that. It's not the reality. It is happening more often, so because if you break down, yeah, sure, pregnancies are happening over 40. Great.
Yeah.
How many of them are just natural? There's a good number. I'm not saying that it can't happen, but
And then you
when
have the internet that's showing you the 59 and the
yeah,
62-year-old woman. You're like, okay.
I I busted out 8. Okay, fantastic. But naturally, like, are you really giving us that info, the real on that information? And that is why, I needed to I took a little bit of a break from the podcast because I really wanted to look at the space and to figure out what I wanted to really at this point do. Because I don't feel it's responsible for anyone to only talk about the fact that yes, you can, it can happen for you too naturally. I
Mhm.
want us to talk about and that's why my focus is there are so many roads to motherhood and to understand that it may not be exactly as you pictured. That is even in your birth plan and in even birth,
Absolutely.
my birth, like I can never get that back. And I think, to be honest, I was chasing a dream after my delivery because it didn't quite go the way that I wanted. And I just always pictured in my head that I'd have a do-over. And I haven't. And I feel that is where there's something from everyone to learn from that, even if they go on and have 2, 3, 4 kids, because there's a process of letting go that I had to really go through to understand that that's what it was. It didn't happen the way that I wanted, but it's okay, and that I have
Right.
the greatest gift, but it's not easy.
You have to come to that realization slowly. And you
Yeah,
have to allow people to grieve the fact that they
their own
didn't have that. Yeah.
yeah, and
Yeah.
not everybody who has a loss is torn up about it. And
Mhm.
that's okay too. I want to normalize that too. There are people who are like, well, obviously it wasn't going to be a viable pregnancy, and I'm thankful that I didn't have to deal with that later. My
Right.
body knew
Right.
what to
Right.
do. There is no right or wrong.
Wonderful, wonderful. I just love that you're in this space, and I'm so happy that we were able to connect. And that was when we spoke at
It was a
the
panel.
NAACP panel in where was it? In East Orange?
Yeah, it was in East
Yeah,
Orange, in the oranges. It
yeah,
was the NAACP of the
yeah.
oranges.
So
Yeah.
that was wonderful. That really was wonderful. I know our time is coming to an end, but this is such a delicious conversation. Just two more questions. So
Sure.
do you feel that you owe your listeners, because of the intersectionality of being a mommy over 40 and then being a Black woman and then being Afro-Caribbean, all of that intersectionality, do you feel that you owe your listeners to show yourself through all of those lenses, um, to pick up all of that DEIB intersectionality, or just be like, this is me? How do you actually, be so inclusive? Yeah.
Because this is where the acting comes in, right? In terms of I feel like I I've been afforded a lens that I don't think a lot of people get to have, to cultivate it, to see all different types of people and see how because as an actor, I feel like we tell ourselves, we can play many different characters and different roles. We just have to be able to tap into, humanity to figure out what you're going to bring to those particular roles. So
Mhm.
when I look at my responsibility in the podcast, I don't feel like there's anyone I cannot relate to. I said,
Okay.
I'm very proud of my representation of representing women of color, Afro-Caribbean women, but I'm happy that though I have a good number of audience members that come from that community, I also have a lot of white, Asian, Latina women too. And so I feel like what they see is, I hope, is that someone who is being transparent,
Mhm.
uh, who is
The
bringing
joy of motherhood.
yes, the joy of motherhood, and also the pains of motherhood.
Yeah.
It's not all cute. It is
Yeah.
not all cute. I love my child, and sometimes I just don't like her that day. And I
Mhm.
feel like that also is something that is so taboo to say. And I think even more so as as a mother over 40, if you're getting into parenthood at that time and that space, you've been by yourself and on your own mission for a long time.
Yeah.
That kid is
I know I said we have to go, but let's talk about that just for 2 minutes. The whole taboo, my kids are 19 and soon to be 17, but the whole taboo that you can't be like, oh, I can't take it today. And being after 40, you have more patience and
healthy.
you're ready for motherhood, and this is what you wanted all the time. So you should be grateful and you should have the patience of a saint. Like, what do your listeners think about that?
Oh, I can't say what I want to say here. It's BS. I can say on my podcast, no, because it's like this whole like, why are you complaining? You didn't even know you were gonna have one. I am a human
And
being.
this is what you paid for and
Yeah,
prayed for.
yeah, and you know what? I
Mhm.
do it again, but it is pain. This is not easy work. It is not easy work. I don't care what stage of motherhood you're in. If you had a child in your 20s, 30s, each decade I'm sure has its own experience, but I can
Mhm, mhm,
guarantee you,
mhm, mhm.
yes, we have patience for some things in 40 when you started a child, but it's also I find myself really battling when it comes to patience sometimes because it is a little bit, I feel um when you've lived your life for so long as on your own terms, and now you have someone else
To
that's
make space for.
to
Yeah.
make space for, I find it challenging sometimes to have patience because you want to say, hey, kid, you're coming to a very well-established, oiled machine of life.
And they're like, yeah, anyway, let's keep
Anyway,
it moving.
you figure out how you're going to live in this life because I've been
Yeah,
doing it for a long time and it's not the case. Sometimes you
indeed.
win, sometimes you lose.
Absolutely. 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 So this is one of my last two questions. Talk to me about the most joyful yeah, the most joyful part of the podcast. I was gonna say about motherhood, but then I remember all of your posts and your daughter coming in the morning and giving you those luscious kisses. I can't imagine anything better. But yeah, let's talk about the podcast. The most joyful part of having your podcast.
I think it's, when I open my inbox, especially I have to say, because I took a good break after the last miscarriage. It broke me. The last one broke me. And I needed some space. I was working with kids at the time and I found I couldn't like young, like newborn um kids. And I couldn't do it. I honestly needed some time to really let the dream go of the second child. And in that time of taking the break, the inbox messages were still coming in. People are still listening. And to see people go, oh, I'm so glad you said that. I've been trying to find the words for that. Um, I went through a twin miscarriage as well. Those things, it brings me joy that what was initially just, came from my pain has blessed the lives of other people and they're recommending it to their friends. It's kind of like it lets me know that it's out there for people to tap into as another resource in this very complicated uh, journey. Sometimes, if you have a complicated journey to motherhood, I'm happy it's there. And those who don't, just to talk about the normalcy, the normal mom aspects, being a mother are there too. I'm really proud of it and brings me joy. That brings me joy to hear their stories.
Thank you for sharing that. It's just so, so very touching, so very touching. So my very last question is, you've had many iterations of your life through this journey. So if you were to write an autobiography at this particular point today, and I was the publisher and I came to you and I was like, all right, Victoria, this is it. I need a title. What title would that autobiography be?
Hmm. Oh, I would say, well, can I say, is that corny to say victorious? But resilience, or maybe a quiet resilience. I say this
Mhm,
not because I feel like there is what I've reconnected to in my adulthood, I think is the child the child that had always been resilient that I forgot about. I forgot that I had, like, a lot of who I am now, I feel was those seeds were planted when I was really young. And
mhm, mhm.
somehow we get kind of off our path. And I
Right.
feel very blessed to reconnect with that strong young girl. And you know who brought that out and reminded me is my daughter. And hearing how she acts in school, like wants to raise her hand first and always wants to reiterate, repeat what the teacher has just said to the
Right.
be quiet. The teacher said be quiet. That was me. I totally forgot because I was
Before the world got in your
in
ear,
my
right?
ear. I would go to her and I remember going, Curry, please, like, let the teacher. And then something occurred as I was telling her something. I'm like, wait, wait, wait. These are my mom's words to me. She said this to me. I was that person. What
Mm.
happened? Where did I become silent? I went the whole opposite way. I'm so glad that I've reconnected to my voice, reconnected to my intuition. That's been the biggest blessing of motherhood. And to see her, like, my job, I know now, is to not quiet that resilience in her, and to nurture it and to let her be the little leader that she's going to be. Yeah, I think that would be my title of my book. Quiet little,
Fabulous.
yeah. Thank you for that question.
Thank you so much. It has been such a pleasure speaking with you, Victoria Latour Duncker, new mommy at 40. Where else can we find you?
Well, newmommy@40.com. Had to figure that other W out. On Instagram, new mommy at 40 as well. There's also a Facebook presence, but I'm more on Instagram. And I'm directing in the community as a play director, and so hopefully we'll be doing the Colored Museum in July, or sorry, end of June, June 24th at Newark Symphony
Okay.
Hall. Uh,
Okay. Okay.
and yeah, I'm really
Fabulous.
thank you so
It
much.
has been such a pleasure. I look forward to seeing you again.
Yes, me too. Thank you very much for having me, and thank you for all the great work that you're doing with the partnership.
I appreciate it. And thank you for joining us, and I'll see you next month at Partnership Live.